My name is David Bortz, and I'm a board-certified internist in solo office practice. I've been in practice here for 25 years in San Diego. I also teach at the university, and I'm an associate professor of medicine there. And we're going to talk a little bit today on Ebola. Ebola is a virus almost localized in the west part of Africa, but unfortunately today with travel, going back and forth, as you know, nothing can be localized to one part of the country. But it's an RNA virus. It's a fairly rare virus. Starting in 1976 when it was first found, we've had a total of 14,500 cases, which sounds a lot, but in 38 years is not very much. Unfortunately, death rate is 35 to 40%, so there has been 5,500 deaths altogether. So the symptoms are, unfortunately, can resemble a flu. So in the very beginning, in this season, the flu symptoms that you would get can resemble it. However, very rapidly it becomes a more severe flu with very high fever. Very rapidly vomiting and diarrhea happens, bleeding from the gums and bleeding all over, and then involvement of the liver and kidneys. It takes 2 to 21 days for the infection to pass from person to person. In that time, you're not infectious until symptoms have happened. We still must be clear that the more danger, especially in the elderly, of dying from influenza this year than there is from Ebola. And basically, if you avoid the secretions, the infectious waste that comes from an Ebola patient, the chances are very low. So unless you are handling secretions like a healthcare worker, taking blood from people, taking the bedding from an Ebola patient where you take away the bedding, handling the feces or the urine like a nurse may do, unfortunately having maybe intimacy with a man who can carry it for 7 weeks in the sperm. The good news is that unlike flu, which is airborne through droplets, you cannot get it through airborne droplets. There has not been a case yet. No, absolutely not. And in fact, the exception proves the rule. The fact that there's been these isolated cases has only been either a person who's been in West Africa who's returned back to the United States, or people like me in the healthcare industry that are dealing directly with an Ebola sick patient. And if you had a random person at the airport that you were walking nearby, you couldn't catch from him coughing or sneezing. And I'm sure we don't share infectious waste just like that from strangers where we meet. So the jokes aside, we shouldn't really joke about it, but jokes aside, that it's extremely rare for us to be able to catch this, and I really think the public should not worry.